everyone. I've just started this again because it seems to have crashed out. My name's Amina and I am one of the midwives. Awesome midwife session that I run with Marley, who is also a Nowbaby midwife. So I'm just waiting for Marley to join, and then hopefully we can get started. Morning, Marley.
Hi. Oh, that was quite a breeze this morning.
You've said that now; it's all going to go wrong.
Oh no. Yeah, I should get my thoughts for myself, shouldn't I? How are we today?
I'm doing okay. How are you doing, Marley?
Yeah, I'm good. I had a very, very long, busy day yesterday. I got back quite late last night, so excuse the bags under my eyes. A bit tired,
And is
but yeah.
this your first live as not Marley Hall, but Marley?
Henry, yeah. So Mrs. Henry now.
So for anybody who doesn't know, Marley got married last month, was it? End of last month?
Yes, it was end of October in Jamaica. Well, yeah, so
Not that
it
we're
was lovely.
envious at all.
It was really, really nice. But yeah, back home, back to work, back to normality, and back to doing lives with you, Amina.
There we go. Well, welcome back. So have we had any questions in already, or should we just?
No, I don't think so. So for those that have joined this morning, if you don't already know, we do live Q&As every couple of weeks or so. And what we ask you guys to do, if you have any questions, obviously me and Amina are both midwives. So if you have any questions surrounding pregnancy or birth, or even looking after your newborn, then please do feel free to type them out. Thank you, Dipti. Thank you for your congratulations. Thank you very much. And yes, just feel free to type out any questions that you might have. We run live and on demand antenatal classes as well. So anybody who wants to check those out, go over to nowbaby.co.uk. There's a huge range. We've been working for the last few years on all of our courses, haven't we? So we've got hypnobirthing, we've got preparing for a cesarean, we've got looking after your new baby, breastfeeding. What else have we got? Infant first aid, emergencies. We've got all kinds of courses going on. Induction of labour is one of the most recent ones that we've popped up on the website. What other ones have I missed?
So we've got things on if you're thinking about having a baby. We've got some free classes for that as well. We've got a class for if you've just found out you're pregnant and you're in that, you may not have already seen a midwife, or you may be waiting to see a midwife, or you might have had your first appointment with a midwife and then actually have been told your next appointment's going to be in 16 weeks, or when you come in for a scan and you're just thinking, actually, I have lots and lots of things that I don't know about and want to kind of find out about. So we've got a course for that as well. So there's a whole range. We cover the kind of whole pregnancy, labour, birth and parenting journey, really, don't we?
Yeah. And everything kind of in between. What might be good actually is to talk a little bit about preemie babies, premature babies, because there's a bit of awareness going on at the moment about prematurity, and yeah, just like NICU awareness. All of your babies were they full term? Have you had any preemies, premature
No,
babies?
I did have one. She was quite a robust size when she was born. So she was born at 34 weeks. So not a kind of a micro premie, but a few weeks early.
Still early.
And strangely enough, I think her pregnancy is the only one I had gestational diabetes in. But she was born at a good 5 pounds. Just went into labour with her, kind of thing. She was quite well when she was born, so she didn't actually need to go into neonatal care. But how about you? Out of your five?
The same. So just the twins, 34 weeks. Well, 34 plus 3, I think, or 34 plus 4, perhaps. So similar, but I think because they were twins, they were little anyway. Yeah. They did spend a little bit of time in NICU, but it was mainly for feeding.
Mm-hmm.
because they didn't know how to suck anything. Suck a breast, a bottle, nothing at all. So yes, they had to be tube fed for a little bit until they learned how to start, sucking properly.
Yeah.
And they just gained a little bit of weight, but apart from that, they were pretty good. But I think some parents that I speak to, especially if they know that there's a prospect that they could potentially have their baby early, like if you've got anybody who's got um, uh, intrahepatic cholestasis of pregnancy, for example, or any other conditions that might indicate an earlier birth, it can be quite daunting, can't it? Especially if you haven't spoken to anybody or if you don't know anybody that's kind of been through that. And sometimes it just happens spontaneously, and there's no sign, at all. Um, and yeah, I think one of the things that I would say to everybody is that, if you are aware that there's a potential for a baby to be born early, then if possible, see if you can speak to somebody from the neonatal unit. I know some hospitals, not all hospitals, but some of them will kind of lead you up there and show you the different areas and what this room means and what that room means, because they have like a hot room and a cold room, don't they? And others might not. They might just come down and chat to you about it instead. But I think it's always good to kind of
Oh,
be a
absolutely.
bit
Yeah.
informed about that,
I
you
mean,
know.
if you are someone at risk, so you've had, being at risk, as Marley has said, either you have a pregnancy related condition that puts you at risk of a premature birth, either like ICP that you said, or preeclampsia, or there's a concern that you might go into labour early, either because you're carrying a multiple pregnancy or that the cervix for whatever reason has started to open up.
Mm,
You should ideally be, in most hospitals, there should be a preterm birth specialist there. So, it varies from hospital to hospital. It can be an entire kind of clinic with a doctor and a midwife and people who you can see quite regularly, or it could be one doctor that specializes in preterm birth, and they can, they have a clinic once a week and you're able to kind of access that. But
mm,
that's always really important. And in a subsequent pregnancy, being really aware of that right from the beginning. So when you book in, to letting people know that you have had a premature birth, because you will need additional care in that pregnancy. But you're absolutely right, Marley, because it can be absolutely overwhelming
mm,
to,
mm,
it didn't happen with me because I went into labour spontaneously and the labour just continued and I had a baby in that way. But I've definitely looked after people where you're just kind of on that knife edge
mm,
every day. You're just holding on and you're kind of going, and if baby is, if you're still pregnant by 34 weeks, then this is what the plan is going to be. And if you're still pregnant by 35 weeks, that's what it's going to be. But if baby comes tomorrow, then this is what we're going to do. And it's so much
yeah,
information
it
that
is.
you have to kind of take
It's
on.
like every day.
Yeah,
It's like every day is just trying to get through every
absolutely.
day can be a challenge, can't it? And we know that every day counts, especially when babies are
Exactly.
very, very premature.
Yeah,
That there's a difference between someone who is 27 weeks and someone who's 28 weeks.
yeah,
There's a massive
yeah,
difference. So trying to kind of
yeah.
keep that pregnancy going for as long as possible is really, really
And
important.
it's so much, we're expecting parents, I know clinicians and midwives and doctors are, like you say, literally assessing from hour to hour, sometimes going, okay, we're at this point and now this is happening. But actually
Mm,
for parents, it's so much information overload. You're being given all
mm,
that, but actually just knowing what questions to ask, where to get support from is really important. I think you talked about the feeding, which is sometimes overlooked in that very, when you're planning for it, it's all about when will these babies arrive and how we will keep them safe. But
mm,
as you yourself said, very quickly that can be, actually, have we thought about feeding them? And that's where maybe those conversations around whether you need, whether colostrum harvesting is an appropriate thing to think about, you know, how can we support you with getting breastfeeding started as quickly as possible? Because we
mm,
know that is you know, the best thing for all babies, but also definitely for the premature babies. It protects their guts. It you know, helps. Breast milk can be incredibly important at that point. Having those conversations whilst you're sometimes waiting for the next day to come and the next day to come
Mm.
can help you feel a little bit more involved in it. You know, you're making those decisions rather than things happening to you can be really important as well.
Yeah, oh, absolutely. And definitely you're right about the feeding, because you know, you give birth, you have these tiny babies or tiny baby, and then it's like, right, what now? I mean, you know, I had mine 7, 8, nearly 18 years ago, and there wasn't really at that time much support and much help with feeding. I think it was because I was a student midwife at the time, and it was like, well, you know, she knows what she's doing anyway, and it's like, well, someone could still come and support me. But yeah, I mean, definitely asking about that, because like you said, it's really important that newborn, that premature babies have access to breast milk. I mean, even though it's only in tiny quantities, um, but a lot of new parents need help and need support with that.
Yeah, yeah,
You know.
absolutely. And that's why actually, you know, when we're doing the classes, and we often get people contacting us saying, you know, is it too early for me to be joining a class or learning about it? And I always say it's never too early. I mean, you know,
Mm,
actually, the more you know, the better informed you are, so you can ask those questions.
yeah,
There is no need to wait until you are 30 weeks or 32 weeks or 28 weeks even to start learning about and start accessing that information and those resources.
no,
You know,
exactly. And the more you learn, the better, really,
yeah,
because
absolutely.
it makes you understand more as well when people are talking. You know, you meet
Yeah, yeah,
healthcare
yeah,
professionals and they're
yeah,
talking in jargon
yeah,
and things like that. But then you're like, oh yeah, I
yeah,
learned about that. You know,
exactly.
and you
You
kind of know
know,
exactly what they're talking about.
yeah, bringing up the feeding question, bringing up that, okay, well, we're making all these plans, but actually, I know how important this is, so what can I do with that? And that can sometimes
Mm,
be a really important bit that people need. I've just noticed
mm.
there's a question from Dipti. I'm 24 weeks pregnant with an anterior placenta. I feel flutters, but they aren't strong. I also have quiet days where the baby seems less active. Is this normal? There we go, Molly. Do you want to start
You-
off? I'm just going to
Well,
through with
I
you.
was thinking actually, because through your work with Tommy's, you must get questions like this quite a lot. So I don't know if you would like to,
So Dipti,
you might have a more concise
uh,
response.
Dipti, can you share with us whether you're, you know, if this is your first pregnancy or if you've been pregnant before or not? Because that can sometimes make a little bit of a difference in that way. Um, but kind of broadly speaking, you should start to feel your baby move by 24 weeks if it's your first baby. You'll start to feel flutters and things happening earlier on in the pregnancy, and that's where that question of if you've had a baby before and if you've been pregnant before, you might, it's not that baby has started moving earlier, it's just that you'll recognize those movements a little bit
The
earlier, and then, you know,
first pregnancy. Sorry. I mean, I don't know if you've seen that. Dipsy's just said it's her first
it's the first
pregnancy.
pregnancy.
Yeah.
Okay, brilliant. So that can be, you know, a really important thing to be aware of, is that, you know, you might have friends and family who are like, oh, I've been feeling my baby moving all, you know, from 18 weeks and I've been feeling kicks and everything. And you're thinking, why isn't that happening to me? And that's okay. If it's your first baby, it's going to take, you know, you're going to, I definitely remember when I was first pregnant thinking, now, was that a little bit of wind or was that a baby kicking? And, you know, it can be a little bit different in that way. So, but by 24 weeks, you should be feeling your baby moving. So it's great that you're feeling the flutters, and that is what they kind of start off like. So by flutters, it's kind of like, you know, kind of a strange movement. It's not a kick, and you won't necessarily be feeling kicks and, you know, pokes and prods at
Like
24 weeks. Your baby is still,
bubbles almost, isn't it? It's
yeah,
almost
yeah,
like
actually,
bubbles or
good
something
way.
under the skin.
Yeah,
Yeah.
that's a good way, because we kind of say flutters and, you know, but actually what does that mean? So what you're feeling is absolutely right. Now, Dipti says she's got an anterior placenta. So for anybody else who doesn't know what that is, an anterior placenta is where the placenta is on the scan. So this must have been picked about 20 weeks. The placenta is towards the front of your bump. So if you're thinking about your bump, it's towards the front of your bump. Usually they tend to be a little bit towards the back, but this can move forward and backwards as your bump grows as well. Sometimes when you've got an anterior placenta, so a placenta at the front, feeling those movements can take a little bit longer because you've got that kind of barrier of the placenta being there that before you can start feeling things moving. So it's absolutely okay. Between 24 and 28 weeks, what you ideally want to do, Dipti, is just keep, you don't need to be monitoring them, and they don't need to be strong. They will start to get stronger. But it's great that you're already starting to pick up, knowing when your baby has quiet moments and busy moments. And what you want to be doing is picking up a pattern of your baby's movements. That every baby moves differently, they're all individual, and we no longer practice in a way where we say, but by within so many hours, this is how many movements you should be having. Every baby
Counting, yeah.
will have their own periods. But what is really important is that you start to kind of really connect with your baby. It's a really good way of bonding with your baby as well. Of kind of, actually, this is when you normally move. And when you kind of get to around that 20, 24, 28 weeks and you think, actually, normally baby moves around here and baby's not moving, that's when you need to contact your maternity unit, because what they will want to know is not how many movements you've had in that day. They will need to know whether you have noticed either a slowing down or a change in your baby's pattern of movement. And that is so difficult to sometimes get your head around. You're a new parent, you're trying to figure it out. But I always say to people that I'm looking after, if you have a moment where you think, actually, I haven't felt this baby move, that's a moment where you contact your maternity unit. Don't sit down, don't drink a glass of water, don't do high jumps, don't try and prod your baby into moving, because if you have noticed it, then that's the first indication that you need to get some help and support.
I think people tend to doubt themselves, don't they, a lot, and we question ourselves. Is it an issue, and do I call up? Do I bother them? And it's kind of like a reoccurring theme that we hear all the time. And I thought I would just leave it for a little bit before contacting. I don't want to waste anybody's time.
Exactly.
And
you're not going to be wasting anyone's
you're
time.
not. No. That's what we're there for. And yes, I mean, if even if you live in an area where the hospital's busy, I mean, all hospitals are busy, aren't they? I mean, it's just how it is.
Yeah.
Yes, I mean, you might find that you go there and there's several people there. When I was working in the day assessment unit, and this was quite a few years ago, I think one day the only people that I actually had coming in to see me that day, so we're talking about a 12-hour shift or whatever it was, were people who were concerned about the baby's movements. And I can't even remember, maybe there's about 20 people who came through. I mean, it was a lot.
Yeah.
And each and every one of them were fine, but that's what we want.
Absolutely.
That's what we want. And it was a discussion about the movements and like what you said, what to expect. And if it's making you conscious enough to notice, oh, it was a bit quiet, or it doesn't, or they don't feel as strong, then that is the time to kind of act on it.
Yeah.
Because subconsciously you've noticed that change, you've noticed that difference. So yeah, don't ever wait and think, oh, it's too late now, it's 11 o'clock at night, I'll wait till the morning. Call up and ask for advice straight away. And the likelihood is they'll say to you, okay, come in, we'll check you over.
Well, at 24 weeks, that's exactly what should be happening. So knowing what to expect as well. At 24 weeks, you should be asked to go into your maternity triage. So not your community midwife, not your GP, because when we listen in those Dopplers, we're only listening in for that minute at a time. What you do need is a proper monitoring of your baby's heart rate. So at 24 weeks, your midwives will ask you to go into your maternity triage. They will do an antenatal check on you. So they'll check your blood pressure, they'll check your urine, they'll measure your bump, they'll have a conversation with you about any other concerns that you have. Is there anything else going on? And then they will monitor your baby's heart rate in that way. So it's not just you're going in for a quick, oh, well, that can be done at home, or, not done at home. My community midwife can do that, and I'll just wait, 2 days to do that. It is really important that you have that clear care and that you're properly monitored in that way. So keep an eye on, for Dipti, It's great you're starting to feel the flutters. The fact that they aren't strong isn't a problem. They will get you. You'll start to feel them more, and you'll start to feel them definitely stronger, even with that anterior placenta. But even if at this stage, like Marley said, you have that subconscious thing saying to you, "Oh, this baby hasn't moved," that's when you go in.
Mm. Absolutely, and just as an add-on as well, you were just talking about, not something you can monitor at home. I just want to say, there are a lot of these handheld Dopplers that are being sold on hundreds of sites, thousands of sites, and that is not a way. They should not be used. I mean, I don't promote them to people anyway, and I know that some people like them for they're a bit of fun, and so it's nice hearing the baby's heartbeat. But you could never pick one up if you're feeling like the movements have changed or baby's quieting down or whatever. Don't ever use them as reassurance. Don't ever pick one up and think, oh, baby's being quiet, let me just listen in. Because you may well find the baby's heartbeat. You might not. You might be picking up your own. But you may well find the baby's heartbeat and think, oh, baby's heart rate's okay, I can hear it.
Yeah.
And that doesn't mean that everything is okay. Because you're hearing a heartbeat that's there doesn't mean that everything's okay. When you do go into hospital or into the assessment unit or wherever it is that you're being asked to go into after 24 weeks to check on the baby, you usually put on a monitor that monitors the baby's heart rate for a longer period of time, and it looks for lots of different variables, not just how many beats a minute that the baby's heart is beating at. So so just to reiterate, please don't ever pick up one of these Dopplers and think, oh, I'm just going to listen for reassurance, because they really aren't reassuring at all.
No, that is so true. And as you say, as midwives, when we use them, we're trained to use them. We know what we're looking for. We've gone through 3 years of training. We have an update every year when we're doing that. We'll first establish what mum's heart rate is like, and then we listen into baby's heart rate. And even then, sometimes you're a little bit like, I've been a midwife long enough to kind of go, is that me picking it up? I can call a colleague and say, do you want to look at that? Knowing full well that I can do that. If anybody, when I've been a community midwife and people have come in saying, and I've had that conversation of, how, baby's movements, and then go, oh, well, actually, yeah, I've been a bit worried about that. I will always say, I can listen in now just for a moment to say that I've heard baby's heart rate, but I can't monitor, I can't do that exactly that long-term monitoring that you need, because we need to see that pattern. We need to see what the movement looks like. We need to see if baby is meeting all those variables, and that can only be done in hospital. And that's why you will always get sent in that way as well. So I'm not a fan of the home held Dopplers. I think it also stops women and birthing people trusting their own bodies. So, people will kind of go, well, baby's not moved, but I've listened in. That is not the right way. Your movement matter more than listening in at any point.
Or someone, or my auntie so-and-so has told me that maybe baby's a bit sleepy, drink a bit of sugar, the heart rate's there, must be okay.
Exactly.
Always listen to your instincts. And we do talk in the full courses that we have, the live courses, talk a lot about what to expect and baby's movements and that kind of thing. So I know Amina and other midwives go into a lot more detail about that. I don't know if we've got any more questions. I don't think we do.
Questions at all.
Our baby's LICOR level is low. Yeah, that's something that you probably would need to discuss with the obstetric doctor, or whoever it is that has done the ultrasound scan for you. Obviously, for us, that's not something that we would be able to kind of give an opinion on, because we don't know you, your wife's, I don't know, I'm just assuming, medical history or pregnancy history. So that's certainly something that I think, if you have a question about something like that, about amniotic fluid levels, I do get a lot of messages from people they'll send me their scan reports with the different sizes of the baby and things, and ask me to interpret it for them, and it's something that we're not really able to do. So what I would say is, if the LICOR is low, if you're concerned, then definitely talk to your healthcare professional about that. Absolutely. But that is something that we see. We do see it.
And I was going to say that, you should be on a very clear
Yeah.
pathway of care. So how it should be being clearly monitored. They should be establishing if we can determine a reason for why that LICA is low. Has there been a leak? Sometimes that might have been the reason for it. Is there another reason that might be happening? It can happen for a variety of reasons that are either related to your health or to your baby's health. And that is why it is really important to speak to your consultant, your doctor, to say, how low is it? What does that mean? It will depend on how many weeks pregnant you are. It will also depend on how well you are, how well baby is. So that's why, in a session like this, it's not where we can't advise you on it, but absolutely it can be quite overwhelming if you've been told that. If you haven't had the opportunity to have that conversation, please do contact your consultant, contact your doctor and say, I need to discuss this. I need to understand what this means. Your midwife might be able to support you with that because they've got your results in front of you and they can talk to you about it. But definitely you will need a clear-cut pathway to just keep mum and baby safe, ensure that people are being monitored so that if any changes in care plan need to happen, that they can happen when and where needed as well.
That's a great answer, Amina. I think we might have time for just one last question.
Okay.
Another Amina, actually.
Oh, there we go.
It's the first pregnancy. What's useful for nausea? Name brand Danzatron. Yeah, I mean, anything any medicines really that you're considering taking in early pregnancy for nausea, check with your doctor first. Talk to your doctor about it first. There are obviously it depends on how severe the nausea is and if there's any vomiting with it and how often it's happening, because some people who have severe sickness through their pregnancy, it might be something that we call hyperemesis or HG, hyperemesis gravidarum, but that's something where the nausea and the sickness is constant. It's happening all day, every day, and it's making you feel pretty poorly. If you're having what we describe as morning sickness, I don't know why we haven't changed that term now to something else, because it's just all day sickness, isn't it? Where you just feel awful. I mean, there's certain things that you can do that might help a little bit. Just like things like eating small meals, but often. So don't leave it hours and hours between eating meals, because that can actually make nausea worse. Make sure you're keeping hydrated and drinking plenty of water and staying away from foods that are fatty. Don't get dehydrated. So make sure you're drinking plenty. Because I know some people get scared of drinking too much or eating when they're feeling nauseous because they feel like they're going to throw up. But then if you're dehydrated, then that can actually make you feel a lot worse, make you feel quite poorly as well. So make sure you're drinking lots. I'm going to be really cliche now, but when talking about morning sickness, things like dry products like crackers and toast, and without too much butter on it, and ginger can help with mild nausea. They're not really going to do much for HG at all. So I would never tell someone who's got HG to go and eat a ginger biscuit, because they probably look at me in disgust if I say that to them, because it's not very nice, is it? But yeah, so there's a few things that you can do in our Just Pregnant class. Do we cover morning sickness and things? Yeah, so we actually have a free course over on the website, nowbaby.co.uk, which goes through the first trimester of pregnancy and what to expect. It talks a little bit about morning sickness and some things that you can do to help you. So do check that out. So that's Nowbaby, so nowbaby.co.uk, and you can sign up for that. And it's a free course that you can download.
And it sounds like if you've been given a name brand drug, which from the name of it, on I can never say it, ondansetron, is usually kind of the second line. So it sounds like, I mean, it may have already been under the care of a GP, or you've spoken to your GP on early pregnancy unit. But if you are feeling nauseous and sick and it's having an impact on your life, you're not keeping any fluids down, or you're not being able to keep anything down. So anything that's having an impact on your life, and only you can judge on that, contact your GP in the first instance, let them know how you're feeling. Now, sometimes GPs may be able to say, actually, I can prescribe you something, and that might be the first line of care, such as cyclizine, which is kind of quite routinely given out. And if that doesn't work, then they'll move on to another option, such as ondansetron. See, I can't say it; it just keeps messing
I used to call it on Danzatron. That's what I used to. I don't know if I'm pronouncing it right either.
But that they can move on to that, which works better for some people. Now, if that doesn't work, you don't just have to suffer. It may be that you might need fluids. You might need to be either admitted into your local early pregnancy unit or gynecology ward for that treatment. So you don't have to just suffer and put up with it, which lots of people feel like they have to. Go and speak to your GP. They'll do those checks. As Marley said, we don't want you getting dehydrated. We don't want you being impacted by it. So actually, if you're feeling unwell with it, speak to your GP. What your GP will prescribe to you. And if it isn't working, then go back and say it's not working, because there are second and third and fourth line options that you can absolutely discuss. And there's a really good organisation called Pregnancy Sickness Support. And they have all of this information on their website. So GP, some of you may be in areas where you've got an early pregnancy unit or an early pregnancy and gynecology unit. So they're called different things, where you can self-refer to them. So you can contact them directly rather than going through your GP. And again, they can offer you that advice. But if you can't get through to your GP and you can't get through to anyone and you're feeling horrible and rotten and the sickness hasn't gone away, then you know, an option is always to go in via A&E as well. But it sounds like you maybe have been offered the first line and this is the second line, and you know, the evidence there suggests that actually it works quite well. So you know, definitely worth trying, because it's always finding that balance between, is this something you can manage, like Marley says, very sensibly, small meals, not letting yourself get too hungry, too tired, too dehydrated, you know, small amounts of it, and some of it you might bring up, but some of it you might retain. Or actually, is this something that is a little bit more like HG or quite severe pregnancy sickness, that actually you just sometimes, you know, I've in my pregnancies, definitely my first one, it was HG, and I needed constant care going through it. Subsequent pregnancies, it was there and then, but actually definitely one of them, I was caught in that cycle of dehydration and just couldn't get beyond it. And I needed almost a reset of having the fluids put in. And once that was in with the medication in, it was like, okay, I've kind of reset it when I'm not trapped in that cycle of being dehydrated and then trying to get something and then getting more and more sick with it. And it can help in that way. So getting that help is really important.
Yeah, absolutely. And just want to end by saying pregnancy sickness support that you mentioned. So obviously they have a website, but they're also on Instagram. So you can go and sort of check out their page. So yeah, pregnancy sickness support. If you put that into search, then their handle should come up.
And your doctor should tell you. I think someone's asked a question of how often you should use it. Your doctor will, whoever has prescribed it for you, whether it's your early pregnancy unit or your doctor, they will tell you how often you should be taking it and how you should be taking it. It's really important that you follow that. If that isn't working, don't try and think, actually, I'll just take a little bit more or I'll stop taking it. Go back to the doctor and tell them what's happening, because they can then, you know, explore other options for you as well.
Yeah. But any medications, or always take them as prescribed. You know, absolutely. Fantastic. Okay, I think we've come to the end today. So we are here. We do these lives every couple of weeks. So just have a little keep a little look out on the website. We'll tell you when the next one is. It's probably going to be 2 weeks today. But occasionally we have to change the date sometimes. So do check on the website. We'll put it up on our social media side.
I was going to say the first Friday of December.
Yeah.
Because I have some lovely mandatory training that I need
to
do in 2 weeks' time. So anybody who's a midwife knows exactly what that is.
Lovely. Okay, yeah, but you can keep updated via the Nowbaby page or the website, which will let you know. And also do check out our WhatsApp channel as well that we have, where we are posting lots of information and things each day. So do come and find that. You can search for it on WhatsApp. There should be a link to the WhatsApp group via the website as well. But if anybody can't find it, just send us a message and we can send it over to you.
Brilliant. Right. Let's catch up with you, Marley.
Yes, you too. Enjoy the rest of the day, and I'll speak to you soon.
Take care, everyone. Bye-bye.
See you later. Bye. Bye.